Hey everybody, it's Kristen here. Welcome to this week's talk. So if you don't already know, May is Mental Health Awareness Month, and so I've decided to take a mental health issue specific to women and highlight it, share about it, discuss it each week. Last week we did emotional eating. If you haven't watched that one, check the information below and I'll provide the link. And this week I actually want to talk about anxiety. And so I feel like we hear a lot about anxiety, especially in the social media age, and there's a lot of buzz around mental health, but I wanted to talk today just about some specifics for women. When it comes to anxiety, and you all may already know this, but I feel like we have a superwoman complex, I guess you could say, where the nurturing side of us takes over and we no longer have any understanding of what we're supposed to do and what we're not supposed to do for other people. And so when I say the superwoman complex, I mean like that mindset that I must do everything for everybody and it has to happen right now. And oftentimes when we get in that mode, we put our own selves to the very bottom of the list and we go to sleep. We're drained, we're up worrying, we're up lacking sleep and lacking the things that we need for the next day. And then we wake up, we're not fully rested, we're already thinking about everything that we are obliged to do that day. And so that superwoman complex, I feel like we often carry that around as if it's just normal. But if we peel back the layers of that, you'll find anxiety under the surface. And so allowing ourselves to look at it in that light, that all of the superwoman complex, I must do this, I must do that, I can't say no, is related to anxiety as well. And so the question is, what are we actually doing to counteract that? Now, we can get into superwoman mode and we can save the world one day at a time, but at some point, we're just human and we need our own self-care. We need to be poured into more than we're pouring out. And so the question is, when do we stop and say, the superwoman idea is something that society has put on me. It's something that my family maybe has put on me or that I'm putting on myself. But when I think about my mental health, it's causing problems for me. Another thing that I want to mention in relation to women is your menstrual cycle. This was I'm almost 30, so it's not like I'm just being introduced to a menstrual cycle, PMS, or anything like that. But it wasn't until like recent years, maybe about 2 years ago, that I was with a group of women and we were just talking about symptoms of a menstrual cycle. How do you know when it's coming? How do you know when it's leaving? And for some reason, it was just that community and us sharing in the woes of it that we actually started to understand that, like, wow, a lot of my mood is based on where I am in my menstrual cycle, what I've eaten, how I'm treating myself. And one thing that we don't often hear associated with our menstrual cycle is anxiety. So you'll hear moodiness, you'll hear tearful, you'll hear irritability, but we don't always hear about how anxiety can increase before, during, or immediately after your cycle. And if you think about before, during, or after your cycle, that's covering a good portion of a month before you're cycling back into the next menstrual cycle. So for women, the superwoman complex, hormones, and then also, I've mentioned it a couple of times before, is the societal pressures on us to be everything and to play these roles. And so I'm going to give you all some signs and symptoms of anxiety, just in case, sometimes we kind of get into these stigmas or these stereotypes of what anxiety looks like. And we think it's just the jittery person that's like sweating in the corner. And really, it can come across in all different kinds of ways. And so here are a few signs and symptoms that I want to highlight. And so if you're having memory problems, concentration problems, trouble sleeping, or even sleeping too much can actually be a poor coping skill for anxiety. Note headaches and stomach aches, anything that's somatic, any issues that you're having within your body. It's always best to check your mental before just going straight to treating the physical, though it could all be involved, and you should always have a doctor involved in these decisions. But it's just good for us to be thinking on all the different levels of wellness. Like, am I eating what I'm supposed to eat? It may not just be the bright lights or the noise that's giving me a headache. It may be something internally. It may be something emotionally giving me a headache. And so constant worrying and overthinking, procrastination, avoidance, irritability, and panic attacks. And I want to go back to overthinking and procrastination. This is something that I struggle with. This is something that for years, all the way back into my childhood, I've always been an overthinker, and not so much a procrastinator, but I can feel it within myself where I want to put off certain tasks because I'm just not sure where to start. I don't have the decisions made on what I'm going to do, how I'm going to do it. And that can often lead you into a stalling period, even if it's mental, even if no one else knows that you're procrastinating on it. It's just an energy, it's just a state of mind that I find myself in due to anxiety. And it's really been transforming for me to look at it as anxiety and not just a label of being an overthinker or being a procrastinator or being a constant worrier. Is to say this is a symptom of anxiety. And once I framed it that way, it's allowed me to kind of care for that part of myself a little bit more instead of the shaming, oh, you're just always overthinking or you can never make a decision on your own. It's kind of helped me to picture it that way so that I can treat it, and not necessarily psychiatrically, but treat it in a way that I'm actually caring for that anxious part of myself rather than shunning it away. And so I don't know if you all can relate to that, but if you're ever finding yourself overthinking or constantly worrying, headaches, stomach aches, all of these symptoms combined together, I encourage you to look a little bit further and see what could possibly be causing anxiety in your life. And so if you are having issues with anxiety, here's a few coping skills. I just want to share a few. You may have your own that you already use, but I think it's good to highlight here that if we handle our anxiety in negative ways, it's not going to help. It's really going to make it worse. And so if you allow sleeping to be your only out for anxiety, when you wake up, everything that was making you anxious is still going to be there. Or if you're drinking, or if you're eating, or if you're using drugs, using medications to deal with your anxiety that's not being monitored by a doctor, then we can rest assured that once we get done coping in a negative way, the anxious thoughts and the anxiety are going to come back. They may even come back tenfold. We don't know, but I do know that we have to find ways to positively and sustainably deal with our anxiety. And so a couple I want to mention is plain and simple, seeking professional help. Women, sometimes we hold off on that because we're so busy, right? We're juggling all these different things that we don't actually say, you know what, I'm going to take care of myself and I'm going to schedule a therapy appointment or an appointment with my doctor, or even just talking to my spiritual leader or a friend group or any sort of outlet for our anxiety. It's just it takes the presence of mind for us to think, I'm going to do something about that. And so I want to highlight that one first, as it really could be helpful for a lot of us. The next one is self-care. Self-care, and then learning to say no by setting boundaries with other people. And so just a reflection question for you all. How much time do you spend taking care of yourself on any given day, on any given week, or even in any given month? How much time do you really say, I'm going to plan something just for myself, to calm myself down, to treat myself well? How often do you do that, and is there room for improvement there? And then also, quite frankly, how often are you saying no to things, especially things that you really don't want to do? Those are the worst for your anxiety because you're already in a mental state of, I don't really want to be here. You kind of brew some resentment behind the idea of having to be there, and then it's sending your anxiety to another level of the responsibility that you've committed to. And so where are some places where you can set boundaries? Where can you start telling people, hey, I'm not going to be able to make it? And trust me, the world will go on if you say that. I know it feels like you must be everywhere, perhaps, but really the world will go on. And so picking a few places where you can set boundaries is a great one. I also note checking your diet for sure, and exercising can also be small ways that we can help with our anxiety, though it may not ever completely go away, or it may take a while for it to completely go away. But these are just some suggestions on how to actively take a step in the right direction to help your mental health. And so I'd love to hear from you all. How are you dealing with your anxiety? Where do you feel like it's come from? Feel free to comment, share, like my posts, and I'll talk to you again soon.